Hello, my name is Paul Golden, and I'm a retired nephrologist and internist, having practiced medicine here in Modesto for about 34 years. I also have dealt with the diagnosis of bipolar disorder for over 40 years. I'll mention at the end two books that I've written, one an educational book and one a memoir. I'm going to start a series, this is the first, of video posts, some of which will be talking about uh, posts that I've already put on my website. The first one I want to talk about today is personality disorders. They're commonly accepted to be 10 personality disorders. The first one was discussed by Susanna Kaysen in her memoir of 1993. She discusses then her period in a psychiatric facility in 1963. By borderline personality disorder, as if you read the book and research it, involves people who are impulsive. They have difficulty with interpersonal relationships and self-image. They fear abandonment, and they have anger issues. Also, a particular kind of self-harm is sometimes seen in which they can cut themselves on the arms or legs in a superficial manner, but enough to leave scars, sometimes parallel scars up and down the arms. The other 9 personality disorders I'm going to discuss briefly. I want to mention first that the first 3, although having the name schizo in them, are not schizophrenic diagnoses. The first one is schizoid personality disorder. These folks are introverted, withdrawn, emotionally cold, and distant. That may be somewhat similar to simple schizophrenia, but they are still felt to be a separate disorder. The next one is paranoid personality disorder, when one perceives others' actions as being threatening, and these folks are untrusting. Next, schizotypal personality disorder are people who need social isolation. They feel anxiety in social situations. They may have some odd behavior and thinking and some unconventional beliefs. The next one we've all heard of, antisocial personality disorder, but these are not folks that necessarily are criminals. These are not the same as psychopathic individuals. These folks may get in trouble with the police, but not in any serious manner. They ignore normal rules of social behavior. They are somewhat irresponsible and callous. And by virtue of these, they do sometimes get into legal issues. And some of it is just due to the combination of the above plus irresponsible behavior. Narcissistic personality disorder is marked by an increased sense of self-importance, feeling that one has only unlimited success. These folks seek attention. They're oversensitive to failure. And they want to consider all of their family, friends, and others as close friends. Avoidant personality disorder are folks who are hypersensitive to rejection, need reassurance, and have difficulty with relationships outside the family circle. Dependent personality disorder, this is seen as a pattern of dependent and submissive behavior in which folks rely on others to make decisions for them. The next one we all can identify a bit with, obsessive compulsive personality disorder, or OCD. This is marked by high levels of aspiration, very conscientious, These folks strive for perfection. They're very orderly and methodical, and they're inflexible to adapting to any change in their routine. They're very cautious, detail-oriented, and by virtue of all of these, may have trouble completing tasks. Histrionic personality disorder are folks that need attention. They need to be at the center of attention specifically. They act out dramatic roles to seek that attention. They crave novelty. They have problems with keeping close sexual relationships, and they use their appearance to garner attention. Psychologists are the first line of therapy for people with these disorders. There does not seem to be any neurotransmitter imbalance in the brain for which traditional psychiatric medications can be used. Cognitive therapy, mindfulness therapy, and occasionally anti-anxiety drugs such as benzodiazepines may be helpful. As far as genetics, there does not seem to be any genetic interplay here. Some feel there is some genetic component, but most feel that these disorders are acquired by either environment or upbringing. I want to mention now the two books. The first one, which is an educational book, came out just about a year ago this month, and it's called An Insider's View of Bipolar Disease. As I said, it's strictly instructional, educational, and it's not about me. The second book, which is a memoir I wrote, will be coming out later this month, that is September of 2016. It's called Bipolar MD, subtitled My Life as a Physician with Bipolar Disorder. You can also visit me on my website, which is www.mdgolden.com, and reach out to me on my webmail, which is paul@mdgolden.com. Thank you, and I look forward to talking about many subjects.